Well, I think that one of the key next steps in terms of immunotherapy is moving it earlier in the course. As I mentioned, we are currently giving it for metastatic patients who have progressed on platinum, but immunotherapy has significant advantages in the earlier setting as well. Patients who have radiation, for instance, secrete a large amount of their tumor antigens as a result of cell lysis with radiation, and this may act as sort of an automated vaccine to enhance the response to immunotherapy. This is really exciting. So this year at ASCO, there were 2 studies that were presented looking at immunotherapy earlier. One evaluated pembrolizumab along with radiation in head and neck cancer, locally advanced. That study was really, really small. What we can say is it seemed relatively safe. What was a more exciting study, though, was a study looking at pembrolizumab in the neoadjuvant space for patients who had resectable tumors. They gave 1 dose of pembrolizumab, and they saw response rates that were very impressive, major pathologic responses after a single dose of immunotherapy. That's really, really exciting. The idea that these patients with intact tumors may actually have a more amplified response than we were even seeing in the metastatic setting when they're heavily pretreated and their immune systems are relatively down from chemotherapy. So that, I think, is a real next step for immunotherapy.